Let's talk about the situation in the United States, because there have been benchmarks set by the CDC for opening, and many states are opening without hitting those benchmarks. We also know that Dr. Anthony Fauci is testifying today. Reggie, maybe we start there. What have we heard Dr. Fauci saying?
Hey, Farah, good morning. So Dr. Fauci has been asked a couple of questions throughout the morning, but in his opening statement, that's where he kind of dictated what the New York Times had reported earlier today, that the U.S. was essentially suffering needlessly, along with a number of needless deaths. And that's simply because the government was too slow to act when this virus first made its appearance in the U.S. and then started to become a serious pandemic by the time we headed in towards March. But Dr. Fauci was also asked questions when it comes to treatments and vaccines. And there was a question posed to him about, could there be a vaccine or some kind of treatment that would be in place that would make it safe to open schools and college campuses by this coming September? And his response was, frankly, I think that would be a bridge too far, kind of pushing back against President Trump's calls to try and have an expedited vaccine prepared to go possibly as early as this fall or into very early winter. Dr. Fauci also making it abundantly clear that there is still an incredibly strong risk, for states to see the number of cases across local levels start to increase dramatically because of the race to reopen here, but also that by the time we head into fall and winter, that it is not inconceivable that this is going to be a second rebound of this virus if testing isn't increased. So this is exactly what Democrats and some Republicans have been looking for, and it is likely going to cause some controversy inside the White House when it comes to the amount of phrasing now that Dr. Fauci has been pushing back that's been spoken by President Trump as of late.
Let's talk about that testing and that information that the president's giving, saying that America is outpacing the rest of the world in terms of testing. Where does testing stand when you compare it to our country?
Well, look, the president came out yesterday and gave a bit of a speech on testing, flanked by signs that said that it's leading the world. And yes, America is now carrying out a significantly higher number of tests than it once was. The problem is they use a lot of comparisons when it comes to South Korea. And South Korea may not be doing things on a per capita basis the way the U.S. is right now, but that's because they increased the amount of testing very early on, and their case numbers were able to be significantly flattened. When the U.S. is looking at this either at a per capita basis or at a per 1,000 rate, they are behind areas like Germany, like Denmark, like Italy, and like Canada. On a per 1,000 basis, the U.S. is doing 26 per 1,000 people. Canada is 28 per 1,000. And if you're looking at this as a percentage range, the U.S. has tested about 2%, maybe 3% of their population in and around the same area that Canada is. But a 3% test rate in Canada, is something like 31 or 32 million people untested. A 3% rate in America is roughly 320 million people that are untested, which is why there is such an increased call to broaden the scope of testing. There has been money that was allocated to states yesterday that will allow them to test roughly 2% of each of their populations with the required amount of equipment needed. But there's also unpublished CDC data out there that shows right now across the states there are dozens of cities that are posting infection rates over the last 7 days, somewhere between 70% and in one Kentucky case, more than 650% increase over the last 7 days. This is why health experts, including Dr. Fauci right now, are calling for such an increase to the number of tests that are being run right now.
You look at somewhere, too, this is a side note, like Wuhan, there's a new cluster there, and they want to test all 11 million people there in Wuhan in 10 days. So, testing obviously key to this, and then contact tracing after that. Let's talk about masks, because there is a new stringent mask policy at the White House, and it applies to almost everyone, Reggie.
It does apply to almost everyone except for the president and the vice president. This is a directive that was put in place yesterday that is now going to force anybody who comes onto the White House campus to have some kind of face covering on, be it the media or be it people that are coming in for day-to-day dealings with the president. The mask requirement will not be required if you are sitting at your own desk or you're isolated in your own office. And this is simply because there have been confirmed cases, like we mentioned last week with the president's valet testing positive, also also with the vice president's press secretary testing positive, and there's now an increased risk that other people inside the building could potentially test positive. We just had a note within the last 15 minutes that the restricted in-house pool that follows the president around, they're now getting the rapid test given to them once a day to ensure that they're not bringing the infection inside. And that's also because Washington, D.C. itself has become a hotspot around the country. We're anticipating our convention center here to be turned into a field hospital in the coming weeks as we still approach the peak of our curve. But this mask policy, again, not for the president, not for the vice president, and that still causes concern that one or both could eventually contract this virus, and that could cause a political firestorm in Washington, because if both men became incapacitated, third in line to assume the presidential duties would be House Speaker Nancy Pelosi, and that is something that Republicans are very fearful of, and why there is such a strict measure now to ensure the safety of people inside the highest government building in the country.
All right, Reggie Cecchini in Washington, thanks so much for that.